The U.S. has been slow to test in many places. The president has told people not to worry. But today, a top American public health expert made it clear things will get worse. How bad it gets depends on how we respond now.
If we wait till we have many, many more cases, we will be multiple weeks behind. The Wayne Gretzky approach, you skate not to where the puck is, but to where the puck is going to be. If we don't do very serious mitigation now, that what's going to happen is that we're going to be weeks behind and the horse is going to be out of the barn. And that's the reason why we've been saying, even in areas of the country where there are no or few cases, we've got to change our behavior. We have to essentially assume that we are going to get hit. People ask, why would you want to make any mitigation? We don't have any cases. That's when you do it.
If cases in Canada do start to spike like they have elsewhere, Canadian hospitals will struggle. They're already operating over capacity. In some communities, emergency rooms have even closed. So what is being done to prepare? Heather Yourex-West is looking into that for us tonight.
In Calgary, new assessment centres for suspected cases of COVID-19 are now in operation. They're a part of the province's pandemic plan aimed at keeping infectious patients away from the ER. Instead, those patients have been asked to call ahead. But across the country, telehealth lines have been struggling to keep up with demand.
We shouldn't conflate or confuse being prepared with being perfect. So we are seeing issues pop up, and as we see those issues, we're addressing them.
Right now, the pressure is on provincial labs and those working to track, assess, and test for the virus. They know that if efforts to contain COVID-19 fail, patient demand on hospitals will soar.
It is important to prepare for a range of different scenarios. But of course, it's sensible to prepare for something worse than prepare for something that's mild.
A worst-case scenario could see hundreds of thousands, even millions of additional patients requiring critical care, far more than existing intensive care units can handle.
In many cases, our hospitals are operating at 120% capacity. They are really concerned as to what the COVID-19 will do to the system.
In Montreal, this shuttered hospital has reopened for just that purpose. Focused now on assessment, the facility treated 20 patients on its first day. But it's not just space that's required. For COVID-19's most critical, ventilators are the difference between life and death. The federal government says it's working to procure additional supplies, but admits that around the world, supplies are becoming tight.
We need to look at where the materials are and how we could have access to these materials and maybe put production in place to increase the amount of supplies and material.
Undeniably now, the road ahead will be tough. With pandemic plans in place, this is no longer a drill. Heather Yourex-West, Global News, Calgary.
Well, we know you have lots of questions about this virus. Starting tomorrow, we will answer some of them. Our Jeff Semple has consulted experts and will join us. And you can send your questions to yourquestions@globalnews.ca. On our website, you'll also find a special page dedicated entirely to the new coronavirus. That's at globalnews.ca/coronavirus.